Good afternoon. This PowerPoint for Module 3, and the topic is co-determinants of health. My name is Rufina Dalmida. I'm a student of Asper University. My professor is Tammy Fisher. It's November 29. I'm sorry, I'm getting over the cold. I'll try to make my voice as understandable as I can. Introduction. There are many factors determining the health of an individual or people. Circumstances and environment are great determinants of health. This makes it hard for people to control most health determinants. Co-determinants of health include social and physical environment, health services, the person characteristics and behavior, and biological and genetics. Social and physical environment are the social and physical factors that determine the health of an individual. They determine whether an individual is healthy or not. They include availability of resources, exposure to violence, and social disorder in the community. Social economic conditions like concentrated poverty and exposure to emerging technology determine whether people are healthy or not. Figure 1. Co-determinants of health. Physical factors affecting health include exposure to hazard and toxic substances and physical barrier affecting people with disability from accessing health services. Poor health outcomes are a result of interaction between social and physical factors. Target audience. The target audience of this health project presentation. The audience that need to work on their health. The importance of teaching health wellness to a target audience. Person's characteristics and behavior. An individual characteristics and behavior can affect the health of an individual. Smoking increases the likelihood of an individual contracting cancer or health diseases. Other individual characteristics include diet, physical activity, hand washing, drugs, and substance abuse. Positive changes in an individual behavior could significantly reduce chronic diseases in populations. Healthy People 2020. Health services. Health services are a significant determinant of health. This is made possible by access or availability of health care. The lack of insurance cover can make people disregard preventative care. It can also lead to delayed medical care. Some of the barriers to accessing health care include unavailability of health care, the lack of insurance coverage, high costs, and limitation due to language barrier. Biology and genetics. Biological and genetics factors that impact your health condition affects specific people. Physical and cognitive effects, the aging makes older adults more prone to poor health compared to adolescents. Sickle cell anemia is common among people with origin from the Mediterranean country, West African countries, India, Saudi Arabia, and a few other regions. Biological and genetics determinants of health includes age, family history of a disease or condition, sex, and inheritance conditions like sickle cells and hemophilia. Impact or determinants of health services. Health services will affect the health of people. This is due to the high cost medical services making health unaffordable to the target population. Unaffordable health will lead to unmet health needs, delay receiving appropriate care and preventative services, the access to and use of services preventing and treating diseases influence the health of the community members. Individual behavior. Individual behavior impacts one's health negatively. Smoking accrues extra costs while seeking treatment for other conditions that might result. Such conditions include cancer and other health diseases. Other behavior like diet, physical activity can also negatively or positively impact the health of an individual. Excuse me. For example, lousy behavior could lead to higher costs incurred in treatment. Biological and genetics factors. Biological and genetic factors can also impact one's health. Some biological and genetic factors affect a specific population. For example, adolescents are less likely to be affected by poor health compared to adults. This is due to the cognitive and physical effects associated with aging. Sickle cell anemia also affects people from specific geological origin. Inheritance determines the lifespan, the health, and possibility of developing certain illnesses impacting health. Social and physical factors. Social and physical factors could also affect the health of a target population. For instance, unavailability of resources could make it hard for people to understand what to do to be healthy. Those resources include proper living wage, jobs, and educational opportunities, and healthy food. Socioeconomic factor affects the availability of health services to the target population. Social disorder like trashing in community can also impact the health of the people. References. These are the references that I use while working on my PowerPoint for this week. This is the end of my presentation, and thanks, Professor Tammy Fisher, for the opportunity. I hope you have a blessed day. Bye.